Reimbursement has been a very interesting issue over the years. I think that in the early days of genetic testing, the tests were very expensive, $5,000–6,000 per test. Only one company did it. And I think that that company was very good trying to get reimbursement, but insurers really were very, very strict about who would get reimbursement or not. What's happened over the last several years with next-gen sequencing and these multi-gene panels is the testing has gotten a lot less expensive. I mean, now things that used to be $5,000 can be $1,000, $1,500. And in fact, I think most companies now, if after several appeals don't pay for the test, the testing doesn't pay for it by their insurance, the cost to the patient really can be fairly minimal. Again, it can be significant to a lot of people. It can be a couple $100s. But on the other hand, it's not like now $5,000. At most is maybe a couple $100, $300, $400, $500 maximum out-of-pocket expense. It really has gotten a lot less than it used to be. And so therefore, I think that as the tests get even cheaper, I think that'll be even less of a problem in terms of reimbursement. I think where the issue really is not so much in reimbursement for the test. It's reimbursement for the counseling that occurs afterwards. Because remember, you have a test, you'll get certain pathogenetic mutations, you'll get other non-pathogenic mutations, variants of unknown significance. And what to do with that, I think, really requires a lot of effort, a lot of human manpower to sit down and counsel people. And I think that's really the real cost of genetic testing, not so much the test anymore. I think that my own personal experiences have been very good with this. I think insurers understand that this is something that has really become part of the standard of care for a lot of people with cancer and families at risk for cancer in this country. So I think, and as the tests get cheaper, I think that particular aspect is not going to be that much of a problem.
The price of genetic testing is plummeting. And that's a great thing for patients and for people interested in hereditary cancers. People draw analogies to Moore's law in computer technology, where the price of computing power has been declining exponentially, and the price of genetic testing for tumors, whether it's for sequencing to look for targetable mutations or for hereditary cancer testing, has also been plummeting. So at the moment, we're talking about testing that's usually on the order of $1,000 to $2,000 and is frequently less expensive than that. Some of the testing could be a little bit less expensive if you do a more tailored panel of genes. So if you know exactly which ones you're looking for, you can keep it simple. The wider panels cost a little bit more money. Interestingly, the technology to do them is awfully similar. And so as we are getting to this era where more and more people are getting testing, I think a couple things are going to happen. The first is the price pressure and competition is going to further drive down the price of genetic testing. The second is that this branded testing may disappear into commoditized testing. Nobody asks what brand of complete blood count testing you had. You just get a CBC. And before too long, that's the kind of thing we're going to be doing for genetic testing, subject to obviously appropriate quality measures. So I think for most people, the expectation is that the price is going to come down. Now, having said that, many patients meet criteria for genetic testing. These are well established, there's strong family history, specific kinds of breast cancers at specific ages. And for those women, there's near universal coverage in the United States for genetic testing for specific genes and hereditary syndromes. We're not seeing problems with out-of-pocket expenses for most women who warrant genetic testing. The price of testing, when you say things like it's $1,000 to $2,000 or something in that ballpark range, that's the retail price, but that's not the out-of-pocket expenses. For most patients who have standard of health care coverage or insurance, the out-of-pocket expensing is negligible or very low.
We've seen individuals where they have fairly striking family histories, but their insurance will not cover for testing, and that is obviously a dilemma and a problematic area to encounter. And what we also see is that some insurances will cover for testing, they will cover for certain extent of testing, but not others, and that can help drive the recommendations and can help inform what we recommend patients, how they would proceed with testing. So there is significant variability from insurance to insurance in terms of what's covered. Medicare covers differently than other insurances. Individual insurances will also cover differentially, so that does impact the decision making. Patients can also have some out-of-pocket costs, and those can vary from company to company. Frequently, what we also do within the setting of our genetic counseling session is to discuss the finances with them, or to send this out to the company to get this pre-approved or pre-authorized by their insurance. And if there are issues, we'll go back and we'll look which companies are the best fit for that particular patient and which ones will minimize out-of-pocket costs for the patient.